Hello, welcome to the AlumierMD Online Training Academy. My name is Victoria, I'm a clinical educator for AlumierMD, and in this video I'll be demonstrating a neutralized peel protocol start to finish. The great thing about the neutralized peels from AlumierMD is that they're classified as light peels, meaning they offer superficial exfoliation of the epidermis. They can be performed on clients of all Fitzpatricks on day one of their clinical visit, meaning there's no pre-treatment required. My beautiful patient here today is a Fitzpatrick 5, and I will be performing a 30% combination peel, 20% lactic acid and 10% salicylic acid, which will offer exfoliation both in the upper layers of the epidermis and in the hair follicle. Let's begin. I'm going to start by cleansing my client's skin with one pump of the purifying gel cleanser. You need to use plenty of water with this cleanser to make sure that you enable a nice watery, bubbly foam. For medical professionals that might be not used to cleansing the skin, introduce the hands slowly to the face and massage slowly to make sure that you don't cause erythema or heat buildup in the skin. You'll notice that I'm using a steady pace. I'm not rushing, but I'm being incredibly thorough to make sure that I have cleansed up into the hairline and underneath the jawline too. We don't want to make this too relaxing for our patients, as we are about to perform a chemical peel and we don't want to lull them into a false sense of relaxation. Finishing your cleanse on the temples is a really comfortable way to indicate to your patient that the cleansing has ended. Using 4x4 soft gauze and cool water to make sure there's no heat build-up in the skin, slowly pull the gauze and remove the product from the face. It's ideal to use these 4x4 gauze, firstly because they're disposable, which helps with bacteria management. It also means that we can do a very thorough job of removing the cleanser without using abrasive surfaces like sponge or flannels. Because the purifying gel cleanser is so effective, we do only need to perform one cleanse. This is a sulfate, paraben and soap-free cleanser that uses coconut surfactants to foam and is the only professional cleanser in our back bar. Once you've cleansed the skin thoroughly, make sure the skin is dry by blotting with a tissue. Each time you move on to the next stage of your treatment, your patient's skin and your gloves must be clean and dry. Now my client's skin is cleansed, I'm going to degrease the skin using 2x2 rough gauze and the balancing solution. This balancing solution contains lactic acid, citric acid, witch hazel, cucumber and burdock, all of which are astringent agents which will help to remove surface lipids from the skin and cellular debris which could otherwise inhibit the penetration of the chemical peel. I'm always moving in the same way around the face, starting at the forehead, proceeding onto the chin and jawline, moving on to the nose and top lip, finishing on the cheeks last. This allows my client to assess any sensitivity she might experience from the balancing solution. If she is going to have high sensitivity, it will happen on the forehead, which is the thickest and most resilient area of the skin. By the time that we come to then apply the degreasing solution to the cheeks, the gauze will have slightly less solution on it, offering a lighter exfoliation to the cheeks, which are slightly more sensitive and vulnerable, just what we want. This is the only stage in the facial in which we do not blot. We don't want to remove the balancing solution from the skin. We want that to evaporate, taking surface lipids with it. Once we've seen that the skin has started to dry and constrict, we know that the barrier has been compromised and the skin is in the optimum position to receive the chemical peel. Whilst this dehydration occurs, I'm going to prepare my chemical peeling portion. Today I'm selecting a combination peel, 30%, 20% lactic acid and 10% salicylic. Using a pipette, I'm going to withdraw 1 ml of this peeling solution into a clean dish or medicine cup. Using a fan brush, I'm going to gently apply the solution in generous amounts, repeating the same application that I did with the degreasing solution, starting on the forehead, moving on to the jaw and chin, finishing on the nose, top lip, and then the cheek. Pro tips when applying a chemical peel. Firstly, never have the cup or medicine cup higher than your patient's face. This means if you were to drop, you're not going to pour it onto your client's face. Always keep your cup in the halo of the patient's face. Secondly, keep your brush nice and flat to the skin. This means an even application. It prevents the pin that holds the brush bristles from digging into the skin. Make sure that the brush never flies over the patient's eyes. Consider the eyes a no-fly zone, and you will always move the brush around the eyes to reach the particular area of the face that you're looking to apply the solution. When starting on the nose, to avoid product pooling in between the eyes that could run down and enter into the eye, start halfway down the nose, covering the base, and then with whatever's left on the brush, pull up the excess in between the eyebrows. When applying the top lip, brush down, being very careful not to apply the peeling solution to the lip, as this isn't epidermis, this is mucous membrane. Lastly, we're finishing on the cheeks, and there needs to be at least a 2 mm gap in between your client's lash line and the beginning of the peel, so that the lash doesn't collect the peel and then it travel into the eye. Please make sure when applying your chemical peel that you're very thorough in your application, making sure that you've left no areas untreated. Make sure to come underneath the jawline and feather slightly so that you don't end up with a demarcation line. Please be sure to come right into the hairline to make sure that when you pull this hairline back, there's not a strip of skin that has not been treated. Be sure to ask your client on a scale of 1 to 10 how they're feeling on the tingle factor. Nicole, if I was to ask you on a scale of 1 to 10 to gauge your tingling, 1 being no tingling at all, 10 being tingling sensation, where would you rate on a scale of 1 to 10 at present?
2.
Okay, this is a perfectly expected response from a neutralized peel. This neutralized peel will stay on the skin for 5 to 20 minutes, depending on patient sensitivity and skin type. A rosacea skin or somebody presenting with sensitivity may only have the peel on for 5 minutes. Somebody with a more resilient or acne-prone skin may benefit from the full 20-minute treatment time. The great thing about this peel is that it's completely controlled and predictable. It's down to the professional to neutralize this peel when she believes that the acquired exfoliation has occurred, and this can happen at any time. So this is a very safe and effective peel for all Fitzpatricks and all skin types. The way that a chemical peel works is by dropping the pH of the skin towards a low pH, creating an acidic environment. When the acquired exfoliation time has occurred, to put a stop to the exfoliation, we will pull the pH of the skin back up using a high pH alkaline neutralizing solution. The AlumierMD neutralizing solution contains bicarbonate of soda, which has a pH of around 10. When applied to an acidic environment, this will pull the pH of the skin back up to neutral, eliminating exfoliation and stopping the peel. When neutralizing, cover your client's eyes with the edge of your hand, not your full palm, as you will cover too much of the skin. Just gently cover the eyes. Ask your client to take a nice deep breath in. And as she exhales, gently introduce the spray onto the skin until you see this beautiful white foam. You can then spray the solution into your gloves and gently massage this into the skin until you feel satisfied that you have neutralized the entire face. Be sure to get into nooks and crannies such as around the nose and in the corner of the lips. Make sure that you come underneath the jawline and out onto the ear. This is really important that you don't begin to massage the neutralizing solution into the skin. Using cool water and 4x4 soft gauze, we're going to very softly but thoroughly remove the peel and the water from the skin. If your patient experiences a slight surge of sensation during this stage, it's perfectly normal as there's a pH gradient shift in the skin. As you can see, my client is having a little bit of an erythemic response across the cheeks and nose. This is a beautiful response to a neutralized chemical peel. Be sure to ask your client on a scale of 1 to 10 where her tingling is, and be sure to ask her if there's anywhere in the face that is still tingling before you move on to the next stage. If the client does experience some tingling in some areas, you can use these 4x4 gauze as a cold compress to really pull heat out of the skin and to reduce any erythemic response. Nicole, do you feel like there's anywhere in the skin that is still tingling?
No.
Wonderful. I feel confident that that peel has been removed and neutralized thoroughly. Again, with clean gloves and clean, dry hands, I'm going to blot the skin to remove any excess moisture from the skin, which could inhibit the penetration of the serums that follow. The genius of the AlumierMD professional peels is that we've kept all antioxidants, peptides and healing ingredients separate from the peeling acids. This helps to maintain the efficacy and integrity of the ingredients, so you know the ingredients that you're advertising you're actually delivering into your client's skin. The Brightening Accelerator contains kojic acid, peptides, hyaluronic acid to really help hydrate and support the skin immediately after a chemical peel. We massage this gently into the skin using soft movements so that we don't disturb the peptides and gentle antioxidants. If your client has experienced a lot of heat in the skin, you may want to apply this product with a brush. It's very important that we don't massage this product into the skin too much, as we want to avoid heat buildup. The Recovery Balm contains specialized ingredients that help to reduce inflammation, aid healing, infuse hydration into the upper layers of the skin and reduce patient downtime. The Recovery Balm also includes CWIP, which interrupts the inflammatory mediators, helping the skin to recover quickly after a chemical peel. This will also feel cooling and soothing for your patient. Every AlumierMD treatment is finished with a broad spectrum physical SPF that will help to protect against UVA and UVB rays immediately after a chemical peel. Nourishing antioxidants will also help to neutralize free radical exposure on your patient's journey home. After every AlumierMD treatment, be sure to give your patient a post-procedure kit to take home. This contains the SensiCalm Cleanser, Recovery Balm and Sheer Hydration Broad Spectrum Physical SPF, with specialized ingredients to help support and protect the skin following a chemical peel. Thank you for watching. If you require any more support with neutralized peels, be sure to contact your business development manager or regional trainer who will be happy to support you in this area.